Demonstrate how to do a thoracic lung assessment. So I have already washed my hands and provided privacy for my patient, and then I did look at her wristband to make sure that her name coincides with the patient that I'm supposed to be seeing today, and it does. So today we're going to talk about your lung fields and assessing the thoracic cavity and lung sounds by visualization, percussion, and auscultation. So the first thing I'm going to do is ask Gladys if she's had any issues or having any pain or concern with her breathing today. No. So the first thing I'm going to do is I'm going to visualize her breathing, her lung fields, and make sure that there's no abnormalities. Make sure she's breathing symmetrically in both lung fields. So I'm just going to kind of watch her breathe, and and at the same time, I'm going to be assessing her skin to make sure that she doesn't have any abnormal moles or masses that I should be concerned with. So if you want to just breathe normal, that's fine. And then while I'm in the back, since I'm watching and kind of observing her breathe, one of the things that I can do is place my hands right underneath her ribs, which unfortunately you, maybe if you can turn to the side here, I can demonstrate in the back. So I'm going to place my hands right below her ribs and ask her to take a nice deep breath. I'm going to make sure that my hands move symmetrically as she's inhaling and exhaling, and she is. And again, I'm going to observe her breathing in her lungs to make sure that she's breathing symmetrically. So that means that you're making sure that both lungs are opening up and expanding the same. And so the next thing I'm going to do is just palpate and ask her if she's having any pain or any concerns anywhere. So you're just going to kind of feel. So does this hurt at all?
No.
Do you have any pain anywhere or any concerns? No. And everything feels normal. So the next thing I would do is percuss, and you're listening for resonance throughout the lung fields, because the air in the lungs causes that type of sound. So you're going to place your middle finger and you're just going to tap and listen in the whole lung field. And the lungs basically go above the first rib into the apex, and then all the way down to the 12th rib, right? And you're going to do that on both sides. Next, I'm going to go ahead and listen to her lung sounds. And when you're listening to a person's lung sounds, you want to listen to both sides at the same time. You can't do it simultaneously, but you're going to go from one side to the other side so that you can compare the lung sounds in both lungs. And then you're going to go down. In the back, you can only hear the upper and the lower lobes of both lungs. Of course, you only have the upper and lower on the left side, and the upper lobe is just very high up. To which rib? So if you can take some deep breaths. So you're going to be listening for inspiration and expiration. And you're going to be listening for any abnormal lung sounds. Now, when you're listening on an older person, you want to take into account that it's kind of hard to continually take deep breaths, and it could possibly make them hyperventilate or become short of breath. So sometimes you'll have to give them a break. All right, and her lungs sound good, but when you're doing that, you're going to be listening for any wheezing, any crackles, any diminished lung sounds that you may have. You can go ahead and turn straight to the front, in case they maybe have pneumonia, which would be, it could be a number of things. It could be diminished lung sounds. It could be crackles from the fluid in the base of the lungs. And then if you have somebody that's possibly in with asthma, they could be having wheezing, which is caused by the narrowing of the bronchial tubes. And an important thing is that if you have somebody with asthma who was having wheezing and then all of a sudden they have diminished lung sounds, that person is in trouble because now their tubes, bronchial tubes, are actually closing and they're having difficulty moving any air whatsoever, and that would require a trip to the emergency room. So do pay attention to the lung sounds, and do know that they can change very quickly. And so then again, we're going to do the same thing in the front. So we're going to percuss from the upper lobes. So again, they're up above, about an inch or two above the first rib, above the clavicle into the apex. And you do have to be aware of a person's anatomy. You know, with somebody that has larger breast tissue, you're not really going to be able to percuss or auscultate the lung fields. But it is really nice sometimes if you do need to get into the lung fields, you're going to just have them move the breast out of the way so that you can actually auscultate those lung sounds. Because with the right lobe, you do need to get down to the 5th, 6th rib so that you can listen to the middle lobe, which is the only area that you can listen to that there. So when we percussed, it all sounded good, and so now we're just going to have her take some more deep breaths for us so that we can listen to the upper lobes. And again, you're going to want to be comparing both sides, inspiration and expiration. And then this is where you can ask her if she could just lift the breast tissue up out of the way, and you can listen to the middle lobe and the lower lobe. And then on the left side, oh, there I heard some long sounds. Thank you. And that concludes the thoracic and lung examination. Thank you. You guys have a great afternoon, and we will talk about this in class.